Hi, Steve Dale talking with Dr. Natalie Marks about a lot, everything going on. And I think, Dr. Marks, I'll start right off with what is most on folks' minds, and that is, can our dogs or cats either give us COVID-19 or can we give it to them?
Yeah, Steve, that's really the $1 million question right now, and on the minds of not only pet parents, but obviously also the veterinary professionals that are on the front lines. There was 2 positive cases of dogs in Hong Kong that were in the homes of positive human COVID-19 patients. And what we're trying to figure out from that is, were those dogs infected? Did they actually acquire the viral infection? And were they going to be sick or potentially a carrier of that? Or were they infectious, meaning that they're in the home, there's a lot of particles because these people are sick, and one of the particles, or some of the particles, because it was a very weak positive, got within the mouth or the nose of these dogs, and therefore when we swab them, it tested positive. And that obviously is what everybody's watching. To this point, as of today, we are not thinking that dogs either will get this from us or that we can give that to them, or cats for that worry. But just like a lot of things that are changing daily, we're following this closely, and we're going to be giving the most up-to-date information as we get that, to make sure that pet parents know exactly what's going on, try to calm their fears, and to stay as healthy as possible.
And to do that, you can follow me on my website, stevedale.tv, the American Veterinary Medical Association for sure, at avma.org as well. The good news is that more and more communities, as they begin to kind of shut down and order people to shelter at home and are keeping only certain businesses open, are considering veterinary practices, quote, essential businesses. I'm happy to see that. I suspect you feel the same way, but there are specific reasons for that.
Exactly. And, veterinarians, we are very unique in our training in that we are the bridge between animal and human health. We call that the One Health Initiative. So we're responsible not only for taking care of the pets that we're seeing, our animal patients, but we're also responsible for public health and making sure that the diseases that some of our dogs and cats and other species can get don't transmit to the humans around them. So things like leptospirosis and rabies and intestinal parasites and the tick diseases, we are the reason that a lot of those things don't get out of control. And so it's very important that we're able to serve our communities and our pet populations in the way that we know how. And also, again, to be a source of information for a lot of very worried parents out there, to make sure that they understand that we're doing what we can to protect them, but also to protect us while we're on the front lines in the medical field.
So a question that people have is, do I go to the veterinarian or not? So I'll take your example of leptospirosis. That is something that potentially, not likely, but potentially people can get to. Certainly it can make dogs very, very sick. And I'm going to add one more question to that as just an example, and that would be the canine influenza virus, or dog flu. Dog flu, by the way, is not related to the coronavirus. It's an influenza virus, but it can make dogs very, very sick. And a small, but real percent can potentially die from it. But if you're not able to go to the veterinarian to vaccinate for either one of those, well, then you potentially can have an issue. So do we need to go to the veterinarian still to maintain these important vaccinations?
Well, it's a great question, Steve. And I will say that right now there's, still a lot of concern and decision-making within the veterinary community as a whole of what our guidelines are, because this is very new territory. But what we will say, and I think everybody agrees upon, is that we are postponing elective procedures right now. Okay. And elective to us might be a neuter or a spay or a cosmetic procedure like a wart removal, things like that. But we are still seeing our patients that are ill, and whatever ill that entails. But also we need to keep our animal population healthy. Because again, just like we've been talking about, there are a lot of the reasons we vaccinate is for the health of the pet and the health of the human family that lives with that pet. So those types of vaccines, leptospirosis, Lyme vaccine, canine influenza, keeping our dog population healthy, they're still very important. What I would encourage pet parents to do, though, is to talk to their own veterinary practice and see what those protocols are, because everybody's doing things a little bit different right now. But most of the strategies are avoiding having human family members coming into the practices unless it's end of life care and decisions, because we're really trying to do what we want to do, which is take care of those pets. But we have to remember that we're trying to social distance and also keep us healthy, because if we are quarantined at home and aren't able to provide care, it really affects a lot of people and pets.
And it's not only the physical health and well-being of our companion animals, they provide, I argue, well-being for all of us. At this particular time when so many of us are so anxious, so stressed, maybe the best thing you can do without an adverse effect is to simply pet your dog or hear your cat purring in your ear. I mean, truly, there is a benefit to having companion animals.
Oh, there absolutely is. And I know every day when I come home from the office, and it's challenging right now, not that it wasn't before, but there's so many new challenges on a daily basis that we're facing with this. As soon as I sit down on the couch, my dog comes right up next to me. I know she knows I need this. And I just literally pet her and breathe. And we know it lowers blood pressure and it lowers anxiety and creates so many endorphin releases and such a positive bond. Obviously, as well as any, about the power of the human animal bond. And I think the more that we can rely on the positive things in our life right now, we can't have enough of them, right? So
Yep.
more than ever, I think if we can spend that time that we're home doing the things that we love, that also our dogs and cats love, the more enriched they can be, hopefully the more enriched we will be.
And very quickly, I know we're running out of time. Are you hoping to see less overweight and obese dogs at the end of all this? Because we can go out, we maybe have the time now to take our dogs for more walks.
Wouldn't that be the silver lining in all of this? That we end pet obesity, because it is such a huge problem in the United States. I'm hoping that we can see people getting out and human challenges as well with weight control. Maybe we can do this together, exercising your cat at home and utilizing puzzle feeders and hiding food and doing things to encourage play and movement. Our biggest thing is we want all of the human population to be social distancing and helping to flatten the curve. And we want to make sure that while we're doing that, we can also take care of our animal population. And for me, specifically dogs and cats. So we're doing the best that we can. Everything's changing daily, but hopefully if we're all working together, we can get through this as quickly as possible.
Well, I can guarantee or your money back, if you take care of your pets, they'll take care of you. Thank you, Dr. Marks.
Thank you, Steve.